Muted.
Oregon Health Authority Problem Gambling Services Unit, and today we are going to be having our Positive Cultural Framework Problem Gambling Campaign kickoff. Our speakers today are from the Center for Health and Safety Culture, Katie Dively and Jay Otto, with Montana State University. And so from moving forward, Katie and Jay will be leading us on this. If you have not muted your phone, please do so, so that we can ensure that we have a clear recording. Welcome, Katie and Jay.
Thank you, Roxanne. Yes, and for those of you who don't maybe have a particular mute button on your phone, you can also dial *6. That will mute you, and then if you are in a position to want to ask a question or answer a question that we might pose of you, you can *6 again, and that will unmute you because we can hear some background noise. But we appreciate that, and we're so thankful to be with you today. As Roxanne mentioned, and I'm coming to you from the Center for Health and Safety Culture at Montana State University. My center is a research scientist. And in that, I do all sorts of things. Primarily my role is as a trainer for the Positive Culture Framework, as well as a community guide. And that means that as organizations and leaders in their communities learn the framework and learn about improving health and safety, they might want some more assistance at the local level about what that looks like to implement at work at the local level. So I'm there to support them in their efforts to do that. Before we move in to agenda and further introductions, why don't I have you introduce yourself?
So we have about 20 people on the line, so I think it's going to be a little hard for folks to introduce themselves individually without doing a roll call. So I'm going to go ahead and start. And so Katie Atkins, can you introduce yourself and where you're from? Okay, we'll move down to Cynthia Edwards. Katie and Jay, I'm not sure that introductions are going to work well using this method, so let's go ahead and just move forward without that, if you guys are okay with that. Cause
not a problem. Jay, let me just be sure I have you. Are you able to chime in?
Yes, I am here. I'm good.
Okay. All right, so you go to the next slide if you don't mind. Jay, why don't we have you introduce yourself? Why don't we do that?
So my name is Jay Otto. I'm a research scientist with the Center for Health and Safety Culture. I have the great joy of getting to work with Katie on a whole variety of projects. I've been with the center for several years now. Prior to that, I did some work at the community level, working on a variety of prevention issues, working for a local hospital, working at the community level. So many of the ideas that we're going to share with you are ideas that we have also applied within community, and I'm looking forward to this exciting project to address this issue in Oregon.
Hi, Jay. This is Roxanne, and real quick, I am going to go ahead and mute everyone because we're getting a lot of feedback, and so people will be able to type in their questions, and I can unmute them individually if they need to ask it. But hold on, folks. Give me a second. I'm going to mute all. Okay, so now, Jay, are you able to chime in again?
Yes.
Okay, great.
Yeah, I'm here.
Great, wonderful. So we're ready to move forward again. I'm sorry, I needed to mute everyone so that we could clean up the recording.
No problem. Go ahead, Katie. I'll turn it back to you. Katie, I think, is muted. Can you unmute Katie?
She's not muted, so dang it. All right, so I guess I have to unmute everybody. I apologize, folks. Okay, Katie, are you able to chime in now?
On the control panel, she still looks muted. I'm getting unmuted, but she still seems to be muted.
And I'm not showing her muted at all, so.
Okay.
Okay, so it appears that I've lost Katie. I can't seem to unmute her. So Jay, can you move forward so that?
Sure. So I can
Okay.
cover, and then we'll get Katie on as soon as we can. So here's our agenda for the session. We wanted to talk about the phase one, the project overview. This will be occurring in the next several months, very quick, just up to June 2017, and then we'll be looking at a subsequent phase after that. We're going to give a little bit of introduction about the positive culture framework. Some of you are familiar with that, maybe from some other work that you've done. We'll talk a little bit about aligning the project and the framework, and then some of your role. So with that, I think we can go to the next slide. We will jump over the introductions just for the technology, but that's something in the future maybe we can come back to and work through. We always love to know the different folks who are on the call. But for today, we'll just hop over that. If you want to go to the next slide. All right, so we always like to begin with sort of the project goal or purpose. And we're initially looking at this first phase as an opportunity to partner between OHA and our center, working on reducing and preventing problem gambling across the state of Oregon. And really, we're looking at laying the foundation for some communication tools that'll be available to you to help reduce and prevent problem gambling. So those tools will be based on the framework that we're going to talk about. We really view communication as an important catalyst to help us do our prevention work. And this is an opportunity for our center to provide some guidance to HA on help putting those tools together that are hopefully be valuable resources for you all as you do your work at the community level. Okay, if you want to jump to the next slide. So some of the things that we're engaging on in this first phase, there are monthly meetings that are occurring to help align and build capacity of folks. We'll be doing some trainings through webinars and other talking points. We will also be doing a data review based on existing sources. There are a number of good sources that we can draw from and already learn some valuable information about this issue that's occurring in Oregon. We're going to look at developing a strategy map for gambling programs so that we can understand the kinds of interventions and resources that are available at the community level. And at the state level. That map will seek to understand things across the social ecology. Roxanne, okay, there we go. We're coming back with the slides. That's cool. Next one. We're on the next slide. There we go. We will also then work on developing campaign recommendations in terms of language and framing. We'll be doing some work to help develop a branding and some logo development, and also helping with some pilot testing and other issues there. We will also be seeking to finalize the brand and the logo, and then the future media that we use will all be tied together with that brand and logo, which will hopefully reinforce some of our efforts, get us some more effectiveness from the media. So those are a quick overview of the project deliverables. Now we'll jump over and talk a little bit about the center, so we give some background there and how we how we can bring some of our resources to the task. So we are the Center for Health and Safety Culture. Our big picture work is to look at how culture influences behavior, in particular behaviors associated with health and safety. So we do work on a variety of issues. Traditionally, we've done work around substance abuse. We're still very engaged in substance abuse work. We're also doing work in traffic safety, violence prevention, child well-being. We use a variety of different backgrounds, so we're very interdisciplinary. Our director is Nick Ward, who has a background in psychology. My background is actually in engineering. Katie's background is in health promotion and prevention. Other staff members have backgrounds in prevention. So we really bring a wide variety of ideas and approaches to this work because the concept of culture is very complex and really, I think, requires a multidisciplinary approach. We conduct research. All of our research is very applied, but we also think it's extremely important to bring the results of our research out to community. And so a lot of our work is also involving training and guidance, and this is something that Katie leads on. And we think that that's a critical part, and that'll be a part of this project as well, because it's not just a matter of making tools, but it's also a matter of providing guidance and recommendations and building capacity around using those tools. So that's a little bit about our center. On the next slide, it's a quick map of where we've done projects across the country. So while we're at Montana State University, we do projects all over the country. About half of our staff are remote staff, so we live across the country. I actually live on the East Coast. Katie lives in Wisconsin. Our center manager lives in Wyoming. Another researcher lives in Wyoming, and another research associate lives in Washington. And then the other half lives in Bozeman. So we live across the country. We do projects across the country. We've done a couple of projects in Canada as well, but we really reach a wide audience with the work that we do. Okay, you can go to the next slide. So I want to talk a little bit about the positive culture framework, which is the approach that we use. It's important just to pause for a moment and think about the word framework. We like to think about a framework as a way of organizing our work. It's a way of, it's not necessarily a program or a strategy. We might think of different efforts that we do to improve health and safety involve certain programs. It might be a curriculum that we do in school. It might be in traffic safety. There might be a specific strategy we're using. Those are very important, but a framework is different. It's a way of sort of organizing that work. And we recognize our work, all of our projects require multiple strategies and programs.
Muted.
And sort of where we do the work, but it is at a very high level.
Unmuted.
And our research is about how we can look at a process and apply it to a wide variety of issues, because we see a lot of this work is grounded in process and skills. If you want to jump to the next slide.
And Jay, I think I'm muted.
Oh, you're back.
Yay!
Yes. Yay!
As we're about to point to turn it over to you to continue talking on the webinar.
That's all right. Jump right in.
So I appreciate that. Thanks for taking over as we figure out some of the technology. So thank you. But this is our core assumption at the center. We really look at an appreciative approach or an asset-based approach at our center, and that core belief that the positive exists and that it's worth growing. And much of our work at the Center for Health and Safety Culture is about taking a look at what are those strengths, what are those, positive or protective, healthy attitudes, beliefs, and behaviors that are prevalent in our communities or in our families and our organizations, to study that and then seek to grow that over time. And so that really becomes the essence of who we are and how we go about our work at the center. One thing that is critically important and allows us to move forward is hope. And we want to be sure that we understand that hope is not just this, happy-go-lucky feeling. Rather, scientifically researched to help us gain momentum in our communities so that we can grow healthier and become safer. And I just love this Cooper-Ryder quote here. Momentum for change requires large amounts of positive affect, such as social bonding, attitudes such as hope, inspiration, and sheer joy of creating with one another. And when we start to talk about hope and study hope as a team here, we know that hope is about two things. It's about the will and the way, and I'll explain those a little bit. We'd say that the will is sort of our motivation or our encouragement that people have and need to move forward towards new behaviors. Now, if we think about maybe our population in Oregon, we might be wanting to move certain individuals towards healthier behaviors, particularly in relation to problem gambling, to safer behaviors there. But we can also take a look at it in terms of key stakeholders and coalition members. We're looking to move them towards different behaviors, perhaps more engagement on this issue, or intervention, or like intervening with a problem behavior. So it's about growing that motivation and that encouragement, that will within people to move forward. And then hope also has another component, and that's the way. And we believe it's about giving people that way or that path forward. And that's our work as prevention professionals, providing people with a path forward, with those solutions that we know exist. So hope is critically important in our work at the center, and we really seek to grow that hope with the communities that we work with. Now, we want to be really clear here, too, that it's a balance. It's not just talking about hope and talking about the positive attributes and actions, of community members or the strengths in our communities, but we also really have to balance that with concern. We have to grow a level of concern so that people feel, that these behaviors are worth engaging in. But we know that research tells us that we have to anchor them with a sense of hope. We have to tell them about the dangers and then empower them and hope that they can make a change. But one of the things that I really wanted to pause for a moment is to discuss sort of this notion of balancing hope with this concern. We know that both are critically important, but it also sort of leads us to the question of whether or not there is a difference between growing concern around a particular issue, let's say problem gambling in the state of Oregon, and instilling fear in someone. So I don't know, Roxanne, you might be able to just say flat out no, but if we can unmute people, because I would love to have a conversation here with folks if we're able, to get your thoughts on what the difference is between concern and fear.
I think that at this point, to unmute everybody, we will get an awful lot of feedback. But if people have any comments they would like to put forth into in a question, we can certainly address that here.
Okay, sounds good. So if you see anything come in, any comments about either, let me know. One thing that we see, I ask these questions in lots of different trainings and webinars, and one thing that I see come forward from the audience is that folks tend to think that concern can come from a place of caring, and that it motivates people to want to engage or to want to learn more. And that seems to be different than the sense that they get from fear, where fear can immobilize people, stop them in their tracks, and sort of shut down that level of thinking. And that's important because we don't want to scare people, right, with some of our prevention messages or use a fear-based approach to where they're no longer thinking. We absolutely want to raise the level of concern, why these dangers, why there is maybe some of these behaviors are concerning or dangerous, without causing that, quick reaction, that fight or flight instinct, where they're not thinking about maybe a rational response or how to move towards a healthier behavior. So we tend to get that response from folks in our trainings. Did you have any comments come up, Roxanne?
No, we didn't, and it looks like folks are following along with you quite well.
Sounds good. So we just wanted to make that distinction. We try very hard to balance A level of concern, it's very important for us to raise that level of concern in communities so that people feel engaged and understand why we need to address the very concerning issues such as problem gambling across the state, but also anchor that with a sense of hope so that people feel encouraged to move forward and also have that pathway forward, that will and the way. So with that, what I am going to do is we thought it'd be interesting to sort of balance the concerns around problem gambling in Oregon with a sense of hope in Oregon as well. And so I've pulled together some information, and I'll have Jay walk through some of that with you. Jay, if you are unmuted.
Yes, I think I am. So cool. I will jump back in. So yes, thanks. So I think it's extremely important, and it's a challenging issue to find how to bring forth concern that fosters engagement, but doesn't turn into fear. And there's that element that sort of if we don't get enough concern, then we might not get engagement. And obviously, there are always competing issues for people in terms of different things that they're concerned about in the community. So when we look at bringing forth some of the different data, certainly problem gambling is a serious public health concern. I think we want to think about, as we go through these, we also want to think about looking at the work through two lenses. One lens is a public health lens, which allows us to think about and look at the prevalence of risky or unsafe behavior, maybe at a different level of scrutiny or a different perspective than if we look at something through a cultural lens. Cultural lens, and as we look at some of these data, I'll bring you back and forth between the two, but a cultural lens may be looking at a higher level, but we want to use both. We want to use a public health lens and a cultural lens. So, when we look at a data piece like over 81,000 people meeting the criteria for a gambling disorder, that's a significant public health concern. We know a lot of negative consequences are occurring with those 81,000 folks. Could lead to other public health issues in terms of substance abuse, also as well as domestic violence, but loss of finances, all sorts of challenges. So when we look at that, 81,000 folks is a very significant concern. We also know that this is a behavior that impacts lots of others, spouses, children, so it can have really devastating impact on an entire family. If you want to go to the next slide. Sometimes we look at concern through the lens of physical impact, so we could look at issues of mortality or morbidity. We can also look at concern from cost. And so the estimates are its cost is over $500 million. That's $500 million, which is a very significant cost. Costs for the criminal justice system, which we know the criminal justice system is weighed by many different issues, correction systems, the human service system, and overall economic health. So very significant financial impacts, which of course everyone has to bear. Even some folks can say, well, this doesn't involve me, I don't gamble, or things like that. Well, those costs are being borne by everybody in a state through taxes and other systems. So it is, in that way, it becomes an issue that starts to impact a very broad, wide variety of folks. Okay, if you want to look at the next slide. As we start to look at and seek to understand some of the data, we can look at the data collected from students, where we often have a lot of good data that we can look at through some of the surveys, like the Student Wellness Survey, that looks at a variety of behaviors, not just gambling, but includes gambling. And then we can see the association of gambling with other risky behaviors. So we can see that students who were reported gambling were also more likely to be skipping school. We know that's a risk factor for all sorts of challenging issues. Being in a physical fight, so we see aspects of physical violence. We can see maybe indicators towards depression, or even in worse situations leading towards potential suicide, so individuals being more likely to be sad for 2 or more weeks. And certainly use of substances, alcohol, marijuana, and other drugs. It's not to say that we're in a position to saying one causing the other, but it's helping us recognize that these behaviors are interrelated, and that opportunities to identify and work and address some of these issues can help us perhaps identify some other issues and recognition of just some deeper underlying risk factors that are occurring. We're also seeing that almost 2/3 of 11th graders indicating that their parents had not talked to them about this. So that's important too when we start thinking about what is the role of families. Are they comfortable talking about this? Do they know what to say? How can they be an important voice in addressing this issue? We know that parents are a very important voice with children, and sometimes they want to say things, but they may not know what to say. So that'll be clearly an aspect that we'll want to look at, but certainly a big opportunity there with 2/3 of them indicating that they had not talked to their children. If you want to go to the next slide. So some things, we also want to look at that issue of hope as well, sort of, and this is where we may look at things from more of a cultural lens than a public health lens. I mean, we can intermix the two, but from a cultural lens, we have about 43% of adults have not gambled in the past year, so this is not necessarily a behavior that everyone as adults is engaged in. We clearly see that about 2/3 of 11th graders did not gamble in the last 30 days. And some of our research that we've done, in particular in projects in Oregon, we know that 11th graders are a pretty good proxy for high school students in general. So we can start to see that about 2/3 of Oregon high school students have not gambled in the last 30 days. So culturally, we have a strong positive culture there, which is good to build on. We know from public health, we're concerned very much about those who are engaging in the behaviors, but we've got some cultural positive norms we can build on. We also know that most Oregon adults believe that the harms associated with gambling outweigh the benefits. So in general, adults are seeing that this is a behavior that can have some significant risk to it, and they're understanding that. So that's another strong piece that we can build on and leverage from a cultural standpoint. Okay, you can go to the next slide. It was good to see that the majority of adults are aware that treatment is available for problem gambling. That's great. 85 is a very strong percentage. We'd like to grow that as well. We need sort of, everybody to see that, but that's good that we've got that strong base to build on. They also believe that treatment is effective, so that's important. If people believe treatment is not effective, they're less likely to engage or make referrals. We've got about 3/4 of adults believing that gambling problems can be prevented. So this is good. They're in alignment with a sense of efficacy to work on this issue. They don't feel it is hopeless. And when we see that the general population, less than 3% of Oregon adults are considered at risk as problem gamblers. So this is good too. Now, this is where we want to be clear. From a cultural lens, this means we've got some strong positive norms, and that it's a very small portion of the population who is at high risk. From a public health standpoint, we know that 3% is very high. So we don't want to look at 3% and say, wow, that makes it look like it's really small. No, from a public health standpoint, 3% is very high, and especially when we think about the tremendous cost associated with that 3%. You go back to that $500 million of cost to the state of Oregon, this is very concerning. And this is something we'll have to work with folks. And it's not that we would always use sort of every statistic or data point in every conversation or every message. It's something that you all need to know as coordinators, and critical stakeholders will need to know. But we'll definitely use different messages at different places at different times. But this is also important for us to help us realize that as a public health issue, we're looking at a smaller group of folks. And that's also going to influence some of the strategies that we seek to use. Because in general, if we talk to a large audience, 97% of them are not necessarily at risk or problem gamblers. So we'll want to think about what messages we want to reach with them to help identify and maybe address that 3%. But from a public health standpoint, we're very concerned about that 3%. It's a very significant number. Okay, if you can go to the next slide. It's also good that there's tremendous infrastructure in Oregon to help with this issue. That's always good as we're starting to work at the community level, because it's not like if we identify folks who need help that there's nothing we can do. So this is very good. We've got prevention and outreach. We've got a 24-hour hotline. We've got opportunities for intervention, crisis, respite care, outpatient, individual, group, and family, and residential treatment services. So that having that infrastructure is so important, and making folks aware of that and being able to connect with that as available. And being able to have that treatment at no cost. So we can reduce the barriers of that, especially financial barriers, because finance is going to be a major issue when we start thinking about gambling and potential barriers to addressing those with at-risk behaviors. So that just gives us a little bit of background about how we can start to think about and view the ideas both through a lens of concern but also hope. So if you go to the next slide, when we think about the positive culture framework, we're gonna look at some ideas about how we're going to leverage this idea of culture to improve health and safety. So to begin with that, we need to begin a little bit and just talk some about behavior. So this is a simplified behavioral model. It is very simple, but it recognizes that with intentional behaviors, we have a certain set of beliefs, cognitions, thoughts in our head that precede that behavior. And those beliefs and thoughts allow us to understand how folks are thinking about things and to understand that these beliefs will predict their behavior. So for certain behaviors, we'll have a willingness and intention to engage in that behavior. We can actually start to assess or measure that. People with a higher willingness and intention are more likely to engage. People with a less willingness or intention are less likely to engage. And there are other factors that will come to bear that will influence actual engagement in the behavior, like the opportunity to engage in the behavior, some of the resources, and those come to play as well. But willingness and intention is an important belief that we can look at. Prior to willingness and intention, we have certain attitudes and beliefs about a behavior. And the more positive attitudes we have about a behavior, the more likely we're to engage in it. We'll also look at other kinds of attitudes or beliefs. We'll look at normative beliefs, beliefs like, do I think it's acceptable to do this behavior, or do people who are important to me think it's okay or not okay to do this behavior? We'll also look at normative beliefs around, like, what does everybody else do? What's typical here? Those are called descriptive norms. So we'll want to look at both kinds of normative beliefs and see how those influence people's willingness and intention. And then we'll also look at a third group of beliefs called control beliefs. And these are, to what degree do I know what to do? And how much am I in control in this behavior? And prior to all those beliefs, we have a certain set of values that will establish a frame and how we connect to our attitudes and beliefs. And these will be important too. It's not so much that we'll seek to change values, but we will try to elicit values. And this is sometimes called sort of establishing a frame or a connection, because it's through those values that we'll build a sense of community that will hold us together to then address some of the attitudes and beliefs. So this is a very simplified model. We use a much more complicated model as we do our research, but nonetheless, the model is very powerful because it helps us realize our work is really focused on addressing people's attitudes and beliefs. We're going to connect to their values, but it's really about changing attitudes and beliefs. So in our efforts to improve health and safety at the community level, we want to connect with attitudes and beliefs. And we call this grouping of values, attitudes, and beliefs cultural factors. And there are obviously lots of values and attitudes and beliefs that people have. Part of our work will be to understand which ones are really relevant to this issue of gambling, how are they shared and maybe not shared, and where are there opportunities to shift attitudes and beliefs to grow the behaviors we want to grow. Now, we know for an individual who's making decisions about gambling, they can get to a place of addiction, and this model will not work as effectively in the case of addiction because we're moving from sort of rational, intentional behavior to irrational behavior, because addiction is very complex. However, even in that circumstance, we're going to be looking at the behaviors of others as well, because we know that it's going to take the engagement of others to impact those individuals who are exhibiting addiction. So we want to recognize when we look at this simplified model, we're not just thinking about the behavior of addiction. We're also thinking about behaviors like intervening with somebody or engaging in education about this. So there are a wide variety of behaviors we want to think about applying to this model, not just the model of gambling itself, or the behavior of gambling itself. So when we think about this, we really want to start thinking about looking at our work through a broader lens than just focusing on individuals. And if you go to the next slide, we want to recognize that individuals exist in a context of nested relationships. So we might think about, yeah, how are we getting people not to gamble too much or not to become problem gamblers? That's the individual frame. But we also have to recognize what's the role of family and peers, and what could they do to help address those individuals? And what's the role of schools and workplaces, and what behaviors could they engage in to help address this issue? And so forth, you know, layers at the community, and we can even go broader to the state. So our work is to think across these different layers of the social ecological model. And when we get those behaviors to start to align across the social ecology, connecting to shared values across there and growing shared attitudes and beliefs, we really start to build a culture that supports improved health and safety around the issues we're addressing. So that's the broad lens that we bring to the work. Each issue that we seek to address, we want to understand that issue across this social ecology and then seek to grow, connect with shared values and grow shared attitudes and beliefs that lead to shared behaviors that improve health and safety. And when we can get that occurring across the social ecology, we really make it a part of the culture where it's much more likely to be reinforced and sustained. In other words, it just sort of becomes a part of who we do and what, who we are and what we do. So if you want to go to the next slide, when we really start thinking about it this way, it really transforms our thinking, because initially we might say, you know, our work is about asking the question, how do I get individuals not to engage in risky gambling? Like, how do I crack that nut? And that's definitely an important part of our work, but really we want to shift our question to what actions do I want to grow across the social ecology to reduce problem gambling? And you can see that's a much bigger question. And in that way, it's a harder question, it's a more complex question. But when we can start to see our work that way, then it's really how am I growing a culture that addresses problem gambling at each layer of the social ecology? And that's going to get us a lot more power and bang for our buck. It's also a way that we can see as being effective, especially when we have a behavior which is relatively rare in terms of a cultural standpoint. I mean, we've got that 3%. We're going to really need to wrap around that 3% with lots of other components to be able to address it. All right, Katie, I think I will toss it back to you.
Thank you. Great. That's perfect, Jay. I appreciate that. So we've gone over aspects of, we're breaking down the name of our framework. As you can see, we've talked about aspects of the positive and that sense of looking at it from an appreciative approach, focusing in on protective attitudes, beliefs, behaviors, elevating that sense of concern. Jay's talked quite a bit here about culture and what it looks like to have a cultural approach, one that's sustained long term. And then lastly, I want to introduce the framework, and not for you guys to become masters of this framework, but for you to understand how we organize our work, particularly in this project, and how we're moving together with OHA to really figure out what steps we want to take to move forward, what strategies perhaps need to be in place to reduce and prevent problem gambling across the state. So this is a picture of our framework. I'm going to sort of break it down in pieces for you. Again, I'm going to go over it at a really high level. But what I want to focus in on first is, I guess Jay mentioned earlier, and I'm just going to bring this back to sort of the front of our focus again, is that this is a framework. It is not a strategy. This is not the one strategy that you will engage in to reduce problem gambling. Rather, it is a framework for organizing our prevention efforts. We always want to ask, you know, we start with the end in mind. We often ask, what's in your green arrow? How do you want to improve health and safety? we're all here. I know many of you don't just focus in on gambling as in your profession. You also do perhaps substance abuse or treatment and other things, but ultimately we're all here to improve health and safety. And we do that by increasing those protective behaviors, decreasing those risk behaviors across that social ecology. And how do we do that? Well, if you think back to that simplified behavior model that Jay showed, it's really about leveraging and understanding and shifting those attitudes and beliefs, or what we call those cultural factors, those values, attitudes, and beliefs across the social ecology, because we know that they're so instrumental in why people engage in particular behaviors. So that's sort of what's in our green arrow, again, ultimately about improving health and safety. Well, how do we do that then? Well, that comes with a process. We have a 7-step process for engaging in the framework, and this might look familiar to you. You may have heard our process before. You may be familiar with the strategic prevention framework, which has a similar but 5-step process, or any other public health planning processes look like this as well. So the blue steps are something that I will go over here at a high level just to get you acquainted with where we are, and then I'll sort of draw some similarities to how we're aligning this project with these 7 steps. So in step 1, we're planning, and often communities and organizations that we're working with are in the planning phase, the step 1 planning and advocating, for a good year at least, because it takes a long time to sort of get your feet underneath you, get your stakeholders in gear, get everybody up to speed, growing people's skills and capacity, not just your own, but also, your colleagues and your coalition members. It's about making timelines, making evaluation plans, and really focusing in on what is our purpose as we move forward, and starting to plan for that assessment that happens in step 2. So step 1 is really important, and I encourage folks to slow down, take a long time in step 1 to be sure that you got your feet underneath you and a solid foundation before we go into assessment. And that's step 2, which is assessing our culture. In step 2, we want to be sure that we're taking a look, across the social ecology. Yes, we want to take a look at our focus population. Maybe that's youth, maybe that's adults, maybe that's both. But we want to take a look, what are the prevalent values in our communities? What are those key attitudes and beliefs that are correlated with gambling, so that we know where we might want to focus some of our efforts. So we're doing assessment in step 2. And in step 3, we're really looking through that information. We're making sense of that data. We're prioritizing opportunities. Where do we need to focus our energies? What is rising to the top here that we might want to, in step 4, create or find some strategies for? You'll notice that the verbiage there is develop a portfolio of strategies. My guess is that all of you know that there is not one single approach that is going to effectively eliminate problem gambling in the state of Oregon. No, unfortunately, it is a multitude of strategies really that helps us transform our approach. It's again looking at what actions do I want to grow across that social ecology to effectively reduce problem gambling or to improve health and safety. So it's looking at it from a portfolio of strategies. Before we go into implementation or wide deployment into those strategies, we want to pilot, test, and refine them, perhaps on a smaller scale. So if we're looking at this from a statewide approach, or you're perhaps looking at it from a county-wide approach, you might say, you know what, that one strategy I'm going to test in this community first. I'm going to grow my own skills, or whoever is implementing that strategy, I'm going to grow their skills first, see how it works, listen well, learn from that, perhaps make any refinements if necessary, before we go into full-scale implementation in step 6. When we are implementing all of our strategies in step 6, we really want to pay attention to what's being said. Prevention programs absolutely strike up a conversation. They should. If they don't, I think maybe nobody's hearing them, but they should spark a conversation, and we want to be ready for that. We want to put ourselves, our colleagues, our coalition members in places to help guide that conversation. If questions come up, if concerns come up, if people come up with issues where they might need referrals, we want people to be in place to help navigate that conversation. And that planning a lot of times happens in step 1, in that planning phase. So we're at step 6, we're implementing our strategies, and then we're moving into step 7, which is evaluation. Of course, we have not waited until step 7 to evaluate. We've planned our evaluation in step 1, and we've incorporated that throughout each of those 7 steps. So as you'll see, this is a circular process. We definitely believe in the order of the steps, but we also know that you don't just go through it once. You actually go through it perhaps more deeply the second time you go around. Or you might add in a new audience the second time around. So it's about going through this multiple times. That was a very quick overview of just the process, the 7 steps. Next, I want to talk about the skills. These are the 3 words that you see on the outskirts of this circle: leadership, communication, and integration. Really 3 critical skills that are essential in our framework. We believe that we've got to grow these skills and those that we're working with in order to successfully implement this framework and ultimately improve health and safety. So prevention is an act of leadership. We are trying to lead our communities to healthier and safer ways, and with that comes, we need to learn how to be strong leaders, and we need to encourage and build the capacity of other leaders to do this work with us. So it's not just you doing this on your own, but that it's a group of collaborative leaders engaging in this work. So we have specific training on how to develop leadership skills, different aspects of leadership, like how exactly do I balance that hope and concern, because we know both of those are so important. How do I lead across the social ecology? How do I even keep the social ecology in mind as I'm doing my efforts? So certain key skills like that. Communication is next. Communication is fundamental in any prevention strategy. I think that it would be hard for us to find any prevention strategy that doesn't require some sort of communication, whether that is implementing a curriculum, right, teaching or educating, promoting a helpline. All of that requires communication. We might be trying to intervene with somebody. That definitely requires communication. We might be seeking to advocate for public policy. That most definitely requires effective communication. So we really spend a lot of time honing our skills and the skills of others so that we can effectively communicate, but that we can communicate together and cohesively as a group of people sort of on the same message. The third skill that we really train on is integration. And integration is really looking, I sort of bring it back to step 4, which is that portfolio of strategies. Integration is about managing that portfolio of strategies. How do these strategies work together? How are we managing? Are some performing better than others? Are some not performing at all? Do we need to add in some strategies that perhaps we had some gaps? We didn't have all of our bases covered. Do we have duplication in strategies? Maybe not both organizations need to do that exact same thing. So integration is about really looking at that portfolio. How is that set of strategies working, and how do I manage that as a leader? So those are 3 skills that we really spend a lot of time with the communities and the organizations that we work with, because we really do believe that greater skills in these 3 areas really do lead to more favorable outcomes. And lastly, and Jay really did spend some time on this, is the social ecology, or the context. Where are we doing this work? Well, we're doing each of these steps across that social ecology. He mentioned, we don't operate in isolation, right? We're very much influenced by the different sort of social environments within our community. Youth are most definitely impacted by the attitudes, the beliefs, the behaviors within their families. So do we have strategies focusing in on the individual, where perhaps we're trying to shift their attitudes, their beliefs, increase their capacity, their skills? Do we have strategies for families? Perhaps, family counseling. How do we change that family dynamic, family rules? What are we doing with schools and work sites? Do we have, how are those systems aligning around gambling? Do we have prevention programs and practices in those environments? Or even, practices that help employees understand how to intervene in a situation should they need to. And then really looking at the community at large. What is our culture saying around gambling? Do we have protective policies and the supportive structures in place to intervene if we need? So it's really looking at this context of a cultural approach across the social ecology, so that we have this reinforcement going on throughout these systems, therefore turning into a long-term sustainable effort long term. So as we take a look at this framework and we align it with the process that we're in, I'll go over this quickly, but I just wanted you all to be aware of sort of the work that we're doing with Roxanne and the Oregon Health Authority and how we fit in our work in this 6-month project with the process. So as we start with step 1, which is planning and advocating, this is where we wrote the goal statement that you saw at the beginning of the slides. We're creating a timeline for all of these events that will be taking place. We're trying to engage stakeholders like yourselves in trying to build capacity, not only of ourselves in this effort, but of you as well. And that comes with, yes, like webinars, we'll provide talking points, etc. Step 2 is assessing the culture, and this is where we're going to be doing a pretty thorough review, and we've already started this work. Review of the assessments that have already been done. We're looking at the student wellness assessment. We're looking at the adult gambling surveys, another youth survey as well, looking at also what strategies are taking place at the state level to really better understand what's being done about this issue. This will help us reveal, do we need to collect additional data? Do we need additional strategies in place to address this issue? From there, we'll come up with a campaign theme. Jay mentioned early on that this early work is to really set the foundation from which one strategy, being a campaign, can be developed. So from that review of the data and the strategies, we'll come up with a campaign theme and then make campaign recommendations. With that, we do want an identifier. So we will be looking to develop a logo and a brand that really helps sort of align and glue all of these pieces together, all of these messages and campaign pieces together as we move forward, but also one that fits really well with what you currently have. You guys have done a beautiful work across the state of Oregon with problem gambling, and we want to be sure that this sort of hangs in line well with what's already been developed. So we're in that process now with graphic design, and your role coming in here will be to help us pilot test that. How do you feel about that? How does your community feel about that, or your coalitions that you work with? In step 6, we'll actually provide you with that logo and that brand and the style guide, how to use that. And then in step 7, we'll actually be providing some recommendations about when we're ready down the road. How can we measure awareness of that campaign, knowing that we have to have some sort of general awareness of the campaign first before we can ever start to come back one day and start to understand, are people even hearing or seeing our messages, so that we can know if we have our messages out there with high enough dosage to actually effectively change attitudes and beliefs. So that's, again, just a really high-level view of how this project, the 6-month project, fits in with a 7-step process. And when it comes to why we've invited you to be part of this webinar, it's to help you understand what we're working on here, sort of behind the scenes, but also to ask you as we move forward, particularly in this area of logo and branding, is that we would love for you to be part of a pilot test for this. As our graphic designer studies and researches what you currently have and comes up with concepts that we'd like you to look at, we will be sending out, I will probably send a link to Roxanne, and she will in turn get that out to you, but we'd love for your feedback there, open, honest, feedback about what you're seeing that he's created. We'd also love to continue to, build capacity. So you've, sat in on this webinar. If you've got folks that you would like to listen in to hear more about what this project is about, please feel free to share this with them. And of course, ask any questions as they come up. My team is always here to answer questions. If you send those questions to Roxanne and she wants to pass them on to us, we are happy to engage in further conversations, because ultimately this project is for all of you. We just want to be sure that you're, engaged as much as you would like to. We also know that you have very busy schedules, so we don't want to put too much on you, but engage whenever you would like. So with that, I know we only have a few minutes left, but I wanted to be sure that we opened it up for any questions or comments. So I don't know, Roxanne, if any have come in, or if you wanted to try to unmute the phones for folks to ask any questions if they have.
We haven't had any come in, but we'll go ahead and do it through the question box. And so if anybody has a question or a comment they'd like to share right now, go ahead and send it in. and we can take this last couple minutes to take a look at those, and I can read them and see what response Katie or Jay or myself might have. So if you have a question, please feel free to send it. And I think, I'll just kind of do a little filler here right now. I mean, our big hope is really to come up with something that we'll be able to use here in the state of Oregon, that you guys will be able to use and implement in your community, and really move forward the conversation about problem gambling. So I'm excited about this opportunity to take this to the next step, and definitely want each and every one of you to share with me your hopes and your concerns in regarding this project as we move forward. So let's see. Could you, Katie? One of the questions is, can you remind us of the timeline? So can you go back a slide to the timeline, and the question is, how much is going to be accomplished by June, hopefully? And so
that's a great question. All of this will be accomplished by June. So we will be working through all of this by the end of June. We will probably, I'm sorry, I should have had my timeline pulled up, the actual dates that we had, Roxanne. But logo pilot testing will probably take place in the next, I would say, month and a half or so, that we should start to see some revisions of this and get that out to all of you. But then, of course, we want to take that back, do some revisions before we send you anything final. But nope, all of this work will be done before June 30th.
Great. And so, and our intention is then to go into the next phase starting in July. So any other questions? That's the only one I've had come through. So just want to make sure everybody's getting the opportunity if they have any questions or just comments that they'd like to put out there. Here's your chance. So I'm not seeing anything come. Oh, here we go. Nope, just a thank you. Thank you out to the Positive Cultural Framework and OHA. So I think at this time, okay, so we got one. How can we address folks that may be ambivalent about the positive cultural norm themes? I've never thought gambling was a problem anyway, so why should we even care?
I think that's a great question. And maybe, Jay, we could respond to that sort of second part of it. I didn't think it was a big problem anyway. Why should we even care? And maybe that sense of hope and concern coming back up there.
Yeah, I mean, I think that's a great question. That's always the issue we're going to have to look at and explore. How do we connect with folks to raise that level of concern? And I think that's part of the research we'll have to do as we look at exploring some of that. I think there are opportunities it's challenging when you look at behaviors that, a smaller portion of the overall population are engaged in. I think we have to bring it back to help folks see that connection to them. So looking at aspects like a cost of $500 million and who's bearing that cost, what would it be like if someone in your family did have this happen to them, and how that would negatively impact you? And certainly at a level, we don't want people to be terrified by any means, but we want them to be well informed, to be able to recognize those potential risk factors and know what to do about it. And so it's a balance, but I think your question is a really good one. It's a question we'll hold before us as well, and one we'll want to explore as we move forward with the project.
Great, thanks, Jay. So I haven't seen any other questions pop up, and I know that we are at time. And so please feel free, if you did have a question that we didn't get to, go ahead and send them to me here. This is Roxanne again, and I will work with Katie and Jay to make sure we get a response out to you. webinar has been recorded. A little rocky at the beginning, but I think we finished up strong. And so we will also be sending this out to you as well. So a big thank you to Katie and Jay for hanging with us and working with us on this project. And I hope you all have a great day. Thank you so much for joining us.
Thank you.
Thanks, everybody. Take care.